You feel it on the daily drive. We do too. But our first responders are the ones really feeling the squeeze of higher fuel prices.
Our Nick Starling is finding out what that means for keeping you safe.
These trucks get 3 to 4 miles a gallon. It's like running in the wind with a sheet of plywood.
That's one way to describe the lack of fuel efficiency when operating these life-saving ambulances. And they drink diesel.
We're budgeting so much for fuel.
Ricky Reeves is the executive director of Texas EMS here in Granbury, where they serve most of Hood County. These ambulances sometimes can travel long distances in this rural county to pick up patients. The Texas EMS Alliance tells us last May they paid over $5,000 on fuel. This May, over $11,000, a 55% increase.
If we can't find a way to cover the fuel costs, then we have to start cutting services. It's sad to say. I didn't think in my 43 years I'd ever see or hear or say that.
MedStar tells us fuel costs have more than doubled compared to this time last year.
That is not something that you can really sustain over time without having some real strategy about covering that cost.
So they're draining the rainy day fund to help cover the costs for now.
We can't just raise our prices because there are fixed payments that we receive from the majority of the people who cover the cost of ambulance service. So Medicare, Medicaid.
It's not just the price of fuel that's really eating at the budgets. It's a price of everyday items because of inflation, like gloves and bandages have gone up by so much.
Before COVID, a box of gloves was about $6 or $7 a box. Now they're $36 a box.
The Texas EMS Alliance says it will ask lawmakers to find a way to reimburse some of the costs they're experiencing so they can continue to serve their communities.
And in the rural areas, it may not be the only medical care. And so if it goes away, it is going to severely impact local communities.
In Granbury, Nick Starling, CBS 11 News.
A dark costs our first responders even more with all the miles and all the emergencies they're racing off to. NBC5's Ben Russell is live in Dallas this morning looking at how these agencies pay for it all and how some are paying far less than we are. Ben, good morning.
Good morning to you, Deborah. Not less in terms of overall price because it costs a lot of money to fill up an entire fleet of vehicles for any one of these agencies. But many of them are paying far less in terms of the price per gallon at the pump. Let's take a look at Dallas County, for example. We have some numbers based on a contract the county signed to fuel its fleet of 900 vehicles for 28 county departments. It had the good fortune to sign a 3-year fuel contract almost exactly a year ago where Dallas County agreed to buy a large amount of gasoline from one vendor, hundreds of thousands of gallons for a couple $1 million for an average index price per gallon of around $1.92. That is way less than what we just reported, what AAA Texas says the average price per gallon here in Texas is at
The cost of gas taking its toll on emergency services. According to the Texas EMS Alliance, with ambulances running on diesel fuel, MedStar tells us fuel costs have more than doubled compared to this same time last year. And they can't pass on the cost to their patients because of fixed payments from Medicare and Medicaid. So instead, MedStar says they're draining their rainy day funds to help cover their fuel costs. In more rural areas like Hood County, they're limiting driving except during emergencies, and if prices don't drop soon, EMS leaders say it will impact public safety.
If we can't find a way to cover the fuel costs, then we have to start cutting services. It's sad to say. I didn't think in my 43 years I'd ever see or hear or say that, but I don't have any other alternative to do.
Well, the Texas EMS Alliance says they will ask lawmakers to find a way to reimburse some of the costs that they're experiencing right now so that they can continue to serve their communities.
You may have noticed the cost of gas is also taking its toll on local emergency services, with ambulances using diesel fuel all day and night. MedStar, which serves Tarrant County, tells us their fuel costs have more than doubled compared to last year. And they can't pass that cost along to their patients because of fixed payments from Medicare and Medicaid. So instead, EMS providers say they're draining their emergency funds and not driving as much in rural areas. They warn if prices don't drop soon, it'll impact public safety.
If we can't find a way to cover the fuel costs, then we have to start cutting services. It's sad to say. I didn't think in my 43 years I'd ever see or hear or say that, but I don't have any other alternative to do.
The Texas EMS Alliance says they will ask lawmakers to find a way to reimburse some of the costs they're having right now so they can continue to serve their communities.
Those extreme prices, though, they're not just hurting pockets for everyday people like all of us. MedStar in Fort Worth says it is costing them double what it did last year to fuel up. So in May, watch the numbers here. They spent $223,000 putting fuel in its ambulances. Last May cost them less than $97,000. That's a huge increase. The Texas EMS Alliance now wants the state and the federal lawmakers to step in here, give them some help. They say spending all this money on fuel is actually stopping them from buying other items they need.